Epilepsy is a condition that affects the brain. Think of your brain as a busy city with electrical signals acting like messengers, constantly moving from one place to another. These messages control everything your body does, from thinking and feeling to moving and seeing. In most people, this electrical system works smoothly, but for someone with epilepsy, this system can sometimes get disrupted. It's like a sudden short electrical storm in the brain. This storm causes a seizure, which is a temporary change in a person's movement, behavior, sensation, or awareness. Epilepsy is diagnosed when a person has 2 or more unprovoked seizures, meaning they weren't caused by a temporary medical issue like a high fever or low blood sugar. It's a common misconception that epilepsy is a mental illness or that it's contagious. This is simply not true. Epilepsy is a neurological disorder, a physical problem with the brain's electrical activity. It can affect anyone, at any age, from any walk of life. Millions of people around the world live with epilepsy, and many lead full, active lives. Understanding the basic facts is the first step toward removing the fear and misunderstanding that often surround this condition. It's about demystifying the brain's complex wiring and seeing epilepsy for what it is, a manageable medical condition that deserves our compassion and support. So, what causes these electrical disturbances? The answer can be complex. For about half of all people with epilepsy, the cause is unknown. This is called idiopathic epilepsy. In other cases, the cause can be traced back to a specific event or condition. A significant head injury, for example, can leave a scar on the brain that disrupts its normal electrical flow. A stroke, which cuts off blood supply to part of the brain, can also lead to epilepsy later on. Brain tumors, whether cancerous or not, can press on brain tissue and trigger seizures. Other causes are linked to issues that happen before or during birth. For instance, if a baby doesn't get enough oxygen during delivery, it can cause brain damage that may lead to epilepsy. Certain genetic conditions can also make a person more likely to develop the disorder. Infections that affect the brain, such as meningitis or viral encephalitis, are another known cause. It's important to remember that having one of these risk factors doesn't guarantee a person will develop epilepsy, but it does increase the possibility. Identifying a cause can sometimes help doctors choose the best course of treatment for the individual. When we think of a seizure, many of us picture a person falling to the ground and shaking uncontrollably. This is known as a generalized tonic-clonic seizure, and it is one of the most recognizable types. But seizures can look very different from person to person. Doctors classify seizures into 2 main groups based on where they start in the brain: focal seizures and generalized seizures. Focal seizures begin in one specific area of the brain. Depending on what that part of the brain controls, the symptoms can vary widely. A person might just feel a strange sensation, see flashing lights, or make repetitive movements like smacking their lips without losing consciousness. Generalized seizures, on the other hand, involve electrical storms that affect both sides of the brain from the very beginning. The tonic-clonic seizure I mentioned earlier falls into this category. Another type is an absence seizure, which is more common in children. During an absence seizure, a person may simply stare into space for a few seconds, as if they are daydreaming. They might not even be aware that it happened. These seizures can be subtle and are sometimes mistaken for inattentiveness in the classroom. Understanding this diversity is key, as different seizure types respond to different treatments. Now let's talk about the symptoms, or what you might notice if someone is having a seizure. The signs are directly related to the type of seizure and the part of the brain it affects. For focal seizures, a person might experience sudden emotional changes, like fear or joy, for no apparent reason. They might smell or taste something that isn't there. They could also have uncontrolled jerking movements in one arm or leg. If the seizure spreads and affects their awareness, they might appear confused or dazed and may not be able to respond to you. For generalized seizures, the symptoms are often more dramatic and involve the entire body. During a tonic-clonic seizure, the tonic phase involves muscle stiffening, and the person may lose consciousness and fall. This is followed by the clonic phase, characterized by rhythmic jerking of the limbs. After the seizure, the person is often tired, confused, and may have a headache. For absence seizures, the main sign is a brief lapse in awareness. Recognizing these signs is not just for medical professionals, it's for all of us. It helps us know when someone needs help and how to respond safely and calmly. If a doctor suspects someone has epilepsy, the first step is a very thorough medical evaluation. The journey to a diagnosis begins with a conversation. The doctor will ask for a detailed description of the seizures, what happened before, during, and after. They will want to know about the person's medical history, any family history of seizures, and any past illnesses or injuries. Eyewitness accounts are incredibly valuable here, so if you saw someone have a seizure, your description can provide crucial clues. The doctor will also perform a neurological exam to check the person's brain and nervous system function, testing things like reflexes, muscle strength, and coordination. To get a clearer picture of what's happening inside the brain, doctors use specific tests. The most common and important test for epilepsy is an electroencephalogram, or EEG. This test is painless and non-invasive. Small sensors are placed on the scalp to record the brain's electrical activity. The EEG can detect abnormal patterns or spikes in the brain waves that are a hallmark of epilepsy. Sometimes a person might need a long-term EEG, where they stay in the hospital for a few days to be monitored continuously. This increases the chances of recording a seizure, which can help doctors pinpoint exactly where in the brain it's starting. Another key diagnostic tool is brain imaging. Scans like a magnetic resonance imaging, or MRI, or a computed tomography, or CT scan, create detailed pictures of the brain's structure. These images can reveal potential causes of the seizures, such as a scar from a past injury, a tumor, or a developmental abnormality in the brain. Blood tests may also be done to rule out other medical conditions that can cause seizures, like infections, metabolic problems, or genetic conditions. Putting all this information together, the patient's story, the exam, the EEG, and the brain scans, allows the doctor to make an accurate diagnosis and create a personalized treatment plan. Once epilepsy is diagnosed, the goal of management is to control the seizures while minimizing side effects, allowing the person to live a normal, productive life. The primary treatment for most people is anti-seizure medication. There are many different types of these medicines available today, and the doctor will choose one based on the type of seizures, the person's age, and other health factors. It can sometimes take time to find the right medication and the right dose. The goal is what we call no seizures, no side effects. For many, this is achievable, and medication allows them to remain seizure-free for years. While medication is effective for about 2/3 of people with epilepsy, what happens when it's not enough? For those with drug-resistant epilepsy, other treatment options are available. One approach is a special diet, like the ketogenic diet. This is a high-fat, low-carbohydrate diet that can sometimes reduce seizures, particularly in children. Another option is neurostimulation. Devices can be implanted in the body, similar to a pacemaker for the heart. These devices send small electrical pulses to the brain to help regulate its activity and prevent seizures from starting. For some, surgery may be the best option if the seizures start in a small, well-defined area of the brain that can be safely removed without affecting vital functions. Living with epilepsy does come with certain challenges and potential complications. One of the biggest concerns is the risk of injury during a seizure, especially if the person falls or loses consciousness. This is why safety precautions, like not swimming alone or wearing a helmet during certain activities, are so important. There can also be an impact on mental health. Living with the unpredictability of seizures can lead to anxiety or depression. It's crucial for people with epilepsy to have strong support from family, friends, and mental health professionals. Though rare, a serious complication called SUDEP, or sudden unexpected death in epilepsy, is a risk, highlighting the importance of achieving the best possible seizure control. While not all cases of epilepsy can be prevented, there are steps we can take to reduce the risk. Preventing head injuries is a big one. Always wear a seatbelt in the car and a helmet when riding a bike, skating, or playing contact sports. Good prenatal care for expectant mothers can help prevent some of the problems during birth that might lead to epilepsy. This includes getting proper nutrition and medical checkups throughout pregnancy. We can also lower the risk of stroke, a major cause of epilepsy in older adults, by managing blood pressure, eating a healthy diet, and not smoking. Vaccinations are also key to preventing infections like meningitis that can cause epilepsy. In closing, a diagnosis of epilepsy is not the end of the road. It is the beginning of a new journey, one that is manageable and can be filled with hope. With modern medicine, strong support systems, and a better public understanding of the condition, people with epilepsy are not just surviving, they are thriving. They are doctors, artists, athletes, and parents. They are contributing to our communities in countless ways. By continuing to talk openly about epilepsy, we break down old stigmas and build a world that is more informed, more compassionate, and more supportive for everyone whose life is touched by this condition. The future is bright.